mature in a person's body, sometimes reaching more than 2 feet in length, and then exit slowly through the skin in a very painful and debilitating ordeal that can last several weeks. With no vaccine to prevent infection or drug for treatment, eradication depends on filtering drinking water to prevent larvae ingestion, thus eradicating the worm, which can survive only in a human host. 6 years after the CDC launched a global campaign in 1980, the Carter Center took the reins, and has since led the effort with additional support from partners like WHO, UNICEF, and the Gates Foundation. The number of people infected by the worm has been reduced from 3.5 million in 1986 to 25,217 cases in 2006, an astounding drop of 99%. In the 3 countries where the worm existed outside Africa, India, Pakistan, and Yemen, eradication is complete. The remaining cases are found in a handful of countries in Africa, mainly in Sudan and Ghana. Some leading sources of premature death are lifestyle-related, such as smoking. WHO estimates that 5.4 million people died in 2005 of tobacco-related illnesses, more than from any single infectious disease. Today there are some 25 known health threats that are linked to tobacco use, including heart disease, stroke, respiratory illness, many forms of cancer, and male impotence. Cigarette smoke kills more people each year than all other air pollutants combined, more than 5 million versus 3 million. Impressive progress is being made in reducing cigarette smoking. After a century-long build-up of the tobacco habit, the world is turning away from cigarettes, led by WHO's Tobacco-Free Initiative. This gained further momentum when the Framework Convention on Tobacco Control, the first international accord to deal entirely with the health issue, was adopted unanimously in Geneva in May 2003. Among other things, the treaty calls for raising taxes on cigarettes, limiting smoking in public places, and strong health warnings on cigarette packages. In addition to WHO's initiative, the Bloomberg Global Initiative to Reduce Tobacco Use, funded by New York City Mayor Michael Bloomberg, is working to reduce smoking in lower and middle-income countries, including China. Ironically, the country where tobacco originated is now leading the world away from it. In the United States, the average number of cigarettes smoked per person has dropped from its peak of 2,814 in 1976 to 1,225 in 2006, a decline of 56%. Worldwide, where the downturn lags that of the United States by roughly a dozen years, usage has dropped from the historical high of 1,027 cigarettes smoked per person in 1988 to 859 in 2004, a fall of 16%. Media coverage of the health effects of smoking, mandatory health warnings on cigarette packs, and sharp increases in cigarette sales taxes have all contributed to the steady decline. Indeed, smoking is on the decline in nearly all the major cigarette smoking countries, including such strongholds as France, China, and Japan. The number of cigarettes smoked per person has dropped 20% in France since peaking in 1991, 5% in China since peak in 1990, and 20% in Japan since 1992. Following approval of the Framework Convention, a number of countries took strong steps in 2004 to reduce smoking. Ireland imposed a nationwide ban on smoking in workplaces, bars, and restaurants. India banned smoking in public places. Norway and New Zealand banned smoking in bars and restaurants, and Scotland banned smoking in public buildings. Bhutan, a small Himalayan country sandwiched between India and China, has prohibited tobacco sales entirely. A number of countries have since adopted a variety of measures designed to limit smoking and exposure to smoke for non-smokers. In 2005, smoking was banned in public places in Bangladesh, and Italy banned it in all enclosed public spaces, including bars and restaurants. More recently, England has forbidden it in workplaces and enclosed public spaces, and France is phasing in a similar ban by 2008. In the United States, which already has stiff restrictions on smoking, the Union Pacific Corporation stopped hiring smokers in 7 states as an economy measure to cut healthcare costs. General Mills imposes a $20 a month surcharge on health insurance premiums for employees who smoke. Each of these measures helps the market to more accurately reflect the cost of smoking. More broadly, a 2001 WHO study analyzing the economics of healthcare in developing countries concluded that providing the most basic healthcare services, the sort that could be supplied by a village-level clinic, would yield enormous economic benefits for developing countries, and for the world as a whole. The authors estimate that providing basic universal healthcare in developing countries will require donor grants totaling $27 billion in 2007, scaled up to $38 billion in 2015, or an average of $33 billion per year. In addition to basic services, this $33 billion includes funding for the Global Fund to fight AIDS, tuberculosis and malaria, and for universal childhood vaccinations. Curbing the HIV epidemic. Although progress is being made in curbing the spread of HIV, 4.3 million people were newly infected in 2006. More than 40 million have died from AIDS thus far, 2/3 of them in Africa, the epicenter of the disease. The key to curbing the AIDS epidemic, which has so disrupted economic and social progress in Africa, is education about prevention. We know how the disease is transmitted. It is not a medical mystery. In Africa, where once there was a stigma associated with even mentioning the disease, governments are beginning to design effective prevention education programs. The first goal is to reduce quickly the number of new infections, dropping it below the number of deaths from the disease, thus shrinking the number of those who are capable of infecting others. Concentrating on the groups in a society that are most likely to spread the disease is particularly effective. In Africa, infected truck drivers who travel far from home for extended periods often engage in commercial sex, spreading HIV from one country to another. Sex workers are also centrally involved in spreading the disease. In India, for example, educating the country's 2 million female sex workers, who have an average of 2 encounters per day, about HIV risks and the life-saving value of using a condom pays huge dividends. Another target group is the military. After soldiers become infected, usually from engaging in commercial sex, they return to their home communities and spread the virus further. In Nigeria, where the adult HIV infection rate is 4%, former President Olusegun Obasanjo introduced free distribution of condoms to all military personnel. A fourth target group, intravenous drug users who share needles, figures prominently in the spread of the virus in the former Soviet republics. At the most fundamental level, dealing with the HIV threat requires roughly 13.1 billion condoms a year in the developing world and Eastern Europe, including those needed for contraception adds another 4.4 billion. But of the 17.5 billion condoms needed, only 1.8 billion are being distributed, leaving a shortfall of 15.7 billion. At only 3.5 carat each, or $550 million, the cost of saved lives by supplying condoms is minuscule. The condom gap is huge, but the costs of filling it are small. In the excellent study Condoms Count, Meeting the Need in the Era of HIV/AIDS, Population Action International notes that the costs of getting condoms into the hands of users, which involves improving access, logistics and distribution capacity, raising awareness, and promoting use is many times that of the supplies themselves. If we assume that these costs are 6 times the price of the condoms themselves, filling this gap would still cost only $3 billion. Sadly, even though condoms are the only technology available to prevent the sexual spread of HIV, the US government is de-emphasizing their use, insisting that abstinence be given top priority. While encouraging abstinence is desirable, An effective campaign to curb the HIV epidemic cannot function without condoms. To any of the few African countries to successfully lower the HIV infection rate after the epidemic became well established is Uganda. Under the strong personal leadership of President Yoweri Museveni, the share of adults infected dropped substantially during the 1990s and has remained stable since 2000. Senegal, which acted early and decisively to check the spread of the virus, and which has an adult infection rate of less than 1%, is also a model for other African countries. The financial resources and medical personnel currently available to treat people who are already HIV positive are severely limited compared with the need. For example, of the 4.6 million people who exhibited symptoms of AIDS in sub-Saharan Africa in 2006, just over 1 million were receiving the antiretroviral drug treatment that is widely available in industrial countries. Although the number getting treatment is only 1/4 of those in need, it is double the number treated during the preceding year. There is a growing body of evidence that the prospect of treatment encourages people to get tested for HIV. It also raises awareness and understanding of the disease and how it is transmitted. And if people know they are infected, they may try to avoid infecting others. To the extent that treatment extends life, the average extension in the United States is about 15 years. It is not only the humanitarian thing to do, it also makes economic sense. Once society has invested in the rearing, education, and on-job training of individuals, the value of extending their working lifetime is high. Treating HIV-infected individuals is relatively costly, but ignoring the need for treatment is a strategic mistake simply because treatment strengthens prevention efforts. Africa is paying a heavy cost for its delayed response to the epidemic. It is a window on the future of other countries, such as India and China, if they do not move quickly to contain the virus that is already well established within their borders. Reducing farm subsidies and debt. Eradicating poverty involves much more than international aid programs. For many developing countries, the reform of farm subsidies in aid-giving countries and debt relief may be even more important. A successful export-oriented farm sector taking advantage of low-cost labor and natural endowments of land, water, and climate to boost rural incomes and to earn foreign exchange often offers a path out of poverty. Sadly, for many developing countries this path is blocked by the self-serving farm subsidies of affluent countries. Overall, industrial country farm subsidies of $280 billion are roughly 2.5 times the development assistance flows from these governments. The size of the agricultural budget of the European Union, EU, is staggering, accounting for over 1/3 of its total annual budget. It also looms large internationally. In 2005 the EU-25 accounted for $134 billion of the $280 billion spent by affluent countries on farm subsidies. The United States spent $43 billion on farm subsidies. These encourage overproduction of farm commodities, which then are sent abroad with another boost from export subsidies. The result is depressed world market prices, particularly for cotton, one of the commodities where developing countries have the most to lose. Although the European Union accounts for more than half of the $104 billion in development assistance from all countries, much of the economic gain from this assistance in the past was offset by the EU's annual dumping of some 6 million tons of sugar on the world market. This is one farm commodity where developing countries have a strong comparative advantage they should be permitted to capitalize on. Fortunately, in 2005 the EU announced that it would reduce its sugar support price to farmers by 40%, thus discouraging the excess production that lowered the world market price. The affluent world can no longer afford farm policies that permanently trap millions in poverty by cutting off their main avenue of escape. Additional help in raising world sugar prices may come from an unexpected quarter. Rising oil prices appear to be increasing sugar prices as more and more sugar cane-based ethanol refineries are built.